it's time for The Doctor Is In.
I'm Katerina Lukatich, and this is The Doctor Is In. Treating breast cancer often requires the attention of multiple physicians and a combination of treatments. Breast surgical oncologist Dr. Lindsay Beakley from the Southern Cancer Center is here to talk about the different surgical options that patients have nowadays. Thanks so much for joining us.
Thank you for having me. I'm excited to be here.
So if someone finds out that they have breast cancer, is surgery the first step that you're looking at?
It typically is. So for ladies who have undergone breast imaging, they have an abnormal mammogram, which has ultimately led to a biopsy. After that biopsy is performed, I am their first stop in terms of physicians who they need to see to begin the process of their breast cancer treatment.
What are some of those surgical options that patients have?
So two main surgical options: breast conserving surgery, what most people refer to as a lumpectomy, where we're removing the area of cancer and then keeping the rest of the breast tissue. And then there's also a mastectomy. And underneath that category, there's the mastectomy alone option, where we leave the patient with a flat closure, a smooth chest wall. And then there are also options for mastectomy that will then be followed by breast reconstruction. So there's a skin sparing option, and very important, and something that I include in my practice is a nipple sparing option.
So surgery can always be scary for someone who's undergoing it. Are we seeing outcomes improving?
We definitely are. Breast cancer treatment is becoming more and more tailored to the individual and the biology of their cancer. Over the years, we have drastically scaled back in the amount of surgery that we do, from the days of everybody getting a modified radical mastectomy now to breast conservation and selecting out just those first few lymph nodes that drain the breast in order to do a sentinel lymph node biopsy. We've really come a long way.
So that's always encouraging.
It definitely is.
And so if someone's going to see a surgical oncologist, what are some of those questions that they should be asking?
I think that the most important question is to obviously ask which surgical option is best for me, because breast conservation is equivalent to a mastectomy, and so I'm a big proponent of breast conservation.
We'll have much more with Dr. Beakley coming up online.